If you or a loved one has ever experienced intense pelvic pain, ridiculously heavy periods, or just unexplained severe bloating, you already know exactly how frustrating it can be to try and find answers. You're bouncing from doctor to doctor, just trying to solve this painful puzzle. Well, first of all, you are absolutely not alone, and your experience is completely valid. Usually, when patients are on this journey, they come across two very common terms: fibroids and endometriosis. So today, we're going to investigate these two distinct medical suspects. Welcome to This Explainer. Our mission today is pretty straightforward. We want to clear up the widespread confusion between these two super common, yet fundamentally totally different conditions. But more importantly, we're going to explore exactly how you can use this knowledge to actually take control of your health and reclaim your quality of life. All right, here is our roadmap for today. Number 1, the shared pelvic mystery. Number 2, understanding uterine fibroids. Number 3, unpacking endometriosis. Number 4, our head-to-head comparison. And finally, number 5, diagnosis and management. Let's get into it.
Okay, Section 1, the shared pelvic mystery.
So why do people mix these two conditions up all the time? Well, it's mostly because they share some incredibly overlapping symptoms. If you're dealing with severe pain and heavy bleeding, honestly, it might feel identical whether you have fibroids or endometriosis. But here is the critical distinction. While the external symptoms look exactly the same, they originate from entirely different realities inside your body. I mean, they happen in different parts of the tissue, they develop for completely different biochemical reasons, and most importantly, they require completely different types of care. Let's move to Section 2, understanding uterine fibroids. Let's investigate our first suspect. Fibroids are medically known as leiomyomas. Basically, they are non-cancerous, benign tumors or growths that develop straight out of the smooth muscle layers of the uterus. I actually want you to imagine the uterus as a room with these really thick muscular walls. A fibroid is essentially a localized swelling, or like a dense, firm knot right inside that muscle structure. And they can vary wildly in size, right? We're talking anywhere from a tiny little seed all the way up to a mass as large as a grapefruit. No joke. Now, fibroids are categorized by exactly where they choose to set up camp in that muscular room. You've got intramural fibroids, which grow directly inside the thick muscular wall itself. These are the most common, and they basically just make the whole uterus feel much larger. Then you have subserosal fibroids. These actually project outward, pointing into your pelvic cavity. And lastly, submucosal fibroids, which push inward into the interior cavity, the actual space where a pregnancy develops. And a quick note on these submucosal ones, they are notorious for causing incredibly heavy bleeding. Because fibroids are actual physical masses, their symptoms are very mechanical. It's really a story of heavy weight and physical pressure on your surrounding organs. You might experience heavy, super prolonged periods, sometimes with blood clots. You might feel this heavy pelvic pressure or fullness, literally a sensation like something is actively pushing down. This weight can even press directly on the bladder, which sits right in front of the uterus, making you feel like you have to pee all the time or making it hard to empty your bladder. And finally, that sheer mechanical weight can radiate outwards, causing this persistent, aching lower back pain. Let's shift our investigation now. Section 3, unpacking endometriosis. Endometriosis is driven by a completely different process. So every single month, the inside lining of your uterus grows this lush layer of tissue called the endometrium. Endometriosis happens when tissue that's similar to that inner lining starts growing completely outside of the uterus. Think of those lining cells like seeds. In endometriosis, these misplanted seeds somehow plant themselves on the ovaries, the fallopian tubes, or the tissue lining your pelvis. And here's where the cycle goes wrong. Even though this tissue is in the wrong place, it still responds to your monthly hormones. So, step 1, it thickens. Step 2, it breaks down. Step 3, it tries to bleed. But steps 4, well, that's where disaster strikes. Because it's trapped inside your pelvis with absolutely nowhere to go, it causes severe, intense inflammation and swelling. Because of this trapped monthly cycle, the hallmark symptom of endometriosis is fierce, persistent pain. We are talking about extremely painful menstrual cramps, medically known as dysmenorrhea, that can literally be debilitating, the kind of cramps that just won't go away with standard over-the-counter painkillers. This deep tissue inflammation can also cause pain during or after intimacy, pain with bowel movements or urination, especially during your period, and even just chronic pelvic pain that sticks around all month long. And over time, this trapped inflammatory process develops scar tissue, called adhesions, which can actually cause your organs to stick together and create massive fertility challenges. Okay, time to put these two in the ring together. Section 4, head-to-head comparison. Let's look at this side-by-side breakdown. And before we dive in, yes, it is absolutely possible to suffer from both of these at the exact same time, which is exactly why understanding this is so crucial. First up, what are they? Fibroids are solid muscular knots, whereas endometriosis is active, displaced tissue. As for location, fibroids are strictly inside or right on the uterine wall, but endometriosis is completely outside the uterus on the ovaries, pelvis, or tubes. Looking at the primary trigger, fibroids are driven heavily by estrogen and progesterone, causing a physical mass to grow. Endometriosis, though, is an inflammatory tissue response to those same hormones. And finally, the signature symptom. For fibroids, it's heavy bleeding and that physical pressure or bloating. For endometriosis, it's a deep, sharp, or throbbing pelvic pain and cramping. So now that we see the differences, how do we solve the case? Section 5, diagnosis and management. Because the treatments differ so drastically, getting the absolute right diagnosis is step number 1. Doctors really have to play medical detective here. For fibroids, it's pretty straightforward. A routine pelvic ultrasound is incredibly effective. Because fibroids are solid muscle masses, they just pop up super clearly on a standard scan. Endometriosis, on the other hand, is a lot trickier. Ultrasounds can sometimes spot cysts that are caused by endometriosis, but the milder tissue layers, they often won't show up on a scan at all. So the absolute gold standard for a definitive endometriosis diagnosis is a minimally invasive surgical procedure called a laparoscopy. That's where they use a tiny camera to look directly inside the pelvis to spot that displaced tissue. Once the mystery is finally solved, the management options are completely distinct and highly tailored to your age, how severe your symptoms are, and your future family planning goals. Both conditions can often be managed with medications first, specifically hormonal therapies or blockers to slow that tissue growth and dial down the pain or bleeding. If medications aren't cutting it, we look at minimally invasive procedures. For fibroids, that might mean uterine artery embolization, which blocks the blood supply to shrink the knot. For endometriosis, surgeons use that laparoscopy to carefully ablate, meaning burn, or excise, meaning cut out the displaced tissue patches. Finally, for the most severe cases, surgeries like a myomectomy, removing just the fibroids, or a hysterectomy, removing the uterus entirely, are potential pathways you discuss with a specialist. And that brings us to the most vital takeaway of this entire explainer. Hear me out on this. Severe pelvic pain and bleeding is absolutely not just something you have to live with. Whether your suffering stems from the heavy physical pressure of a fibroid or the deep, scarring inflammation of endometriosis, highly effective treatments exist right now. You do not have to accept this pain as your normal. There are pathways designed specifically to give you your quality of life back. So I want to leave you with this challenge. Now that you know the difference, what is your next conversation with your doctor going to look like? Don't wait. Write down your symptoms, track your cycle, define exactly what you are feeling based on what we've covered today, and confidently take action with a trusted gynecologist. Thank you so much for joining me to decode this topic. Take care of your health, and please, keep seeking the answers you absolutely deserve.